we'll talk. I always try to talk too much, and I know most of you say, hey, we hear this before us. See, what is that, Marcus? Let's come up next week. Tomorrow. So, thank goodness. We can't even watch TV, can we? But tomorrow we'll determine some things here in the state. I would think, or at least get on the start. My wife and I went to vote last week, and she thought, we don't know, I'm assuming everybody, the little paper ballot didn't run through the machine and everything. So we sit together, because I tell her, I said, let me show you how to vote here. She said, no, I'll take care of it. So, comes my name on the ballot there, and I said, you want me to mark that for you? She says, no, I'm gonna write it. I said, believe I will too. I said, maybe if I don't get enough votes, I'll get to stay at home with you. Let me have your ballot. She voted for me, so she did not vote. That's a good way to keep that out. But I'm running unopposed, so I am on the ballot thing. Some of us got these jobs that no one else wants. I was telling Jamie there, Jamie's brother is one of my city council. He's running, and I've just got a wonderful council, and those things like that keep me in office. I've got a wonderful staff. They whenever Caitlin, we were on a big call yesterday about an ARC grant, and I just sit back and let my lady in the office take care of it. Caitlin knows if she needs anything, call her. She knows who to talk to. But got good people, and that's the reason that makes life a lot easier. Mark, when we quit talking, we're ready to go. Ready to go. Call this to order. Linnell, we get you earn your money.
All righty. Ready for the roll call?
Roll call.
All right. Mayor Gibson.
Here.
Charlene Whitaker. Keisha Richards.
Here.
Cindy Putman. Here. Christine McMillan. Bill Fox.
Here.
Christy Palin. Bill Gibson. Ann Stamps. Present. Michael Burton. Tracy Long. Nestor Chavez.
Here.
Misty Fye. Barbara Wheeler. Here. Bob DePriest.
Here.
Patty O. Here. Morgan Jones. Nicole Wiggins. No one.
All right. Have approval of the minutes. It seems like it's been a long time, Mark. It's been back in,
We missed our last meeting, right? We didn't have, I can't remember.
We didn't have a quorum.
We didn't have a quorum that day, that's right. We knew ahead of time that several more people couldn't be here, so.
and I was looking forward to coming and everything. I canceled a big vacation and all this. I'm really disappointed, so, but that's all right. We'll make that for you. All right, got a motion to approve the minutes from April 1st.
I'll make a motion.
Got a motion, got a second?
I'll second.
Second? Either one? All in favor? Aye. Opposed? Motion carried. All right. Next item is the CSBG, Linnell.
All right, thank you. First, you will have some dashboards where it has been a while we've met. You'll notice we have February through June of dashboards. Just always give those to you for you to review. These are some funds that run directly through our 14 county offices with these programs. What I wanted to highlight and just bring to your attention today, because we are continuously reviewing this data, looking for anomalies to see what's going wrong or if we're doing something well. And we had been tracking our LIHEAP because our numbers were lower than what we felt they should be. Notice there was lots of changes, online applications and things for this program here. So we started looking and asking questions, And we realized that a lot of folks thought that they had to apply online by themselves rather than being able to come into our local offices to apply. So we started a big outreach campaign this summer, and we really started and focused here in Putnam County on our summer feeding. We got into the school systems, and so we tried to encourage all other counties to make contact with the school boards and the summer feeding. So if you look at those June numbers, you can see that they're finally starting to increase. We're very happy about that. So any questions that you guys might have on the dashboards for me? All right, then we're going to move in behind the dashboards. You are going to see a document that talks about our community needs assessment. Through the Community Services Block Grant, each 3-year cycle, we are required to do a community needs assessment. We remember worked with our policy council for some focus groups with one of our meetings, and then we have surveyed over 2,000 individuals ranging from 18 all the way up to the senior population to try to determine and rank what folks feel like the top 5 needs are in the Upper Cumberland. So that's what I'm showing you today is a portion of our community needs assessment. Access to affordable housing was number 1. Higher paying quality job opportunities was number 2. Resources for individuals experiencing homelessness. Number 4, wraparound services for individuals with disability. And this one really shocked us, affordable recreation activities for youth and families. So that's the first time that that has ever come into the top 5. Notice that food insecurity was not in our top 5, but access to nutritional foods did come in at number 6, I believe it was. Also transportation come in around 13, I believe. What I'll be doing is sending you guys a link by email with the full needs assessment. It's about this thick, so there's no way that I could print that for you and you guys wouldn't want to lug that around. So I'm going to send that to you guys. If you have any questions as you're reading through that, if you want to delve deeper, reach out. If you know community organizations that do their own needs assessment or would like to use some of the data in our needs assessment, please share that with them. We do this for the community, and we like to share this needs assessment with any other organizations that might need that. You can see that we've put our response to these top 5 needs. And then the very last thing I wanted to bring to your attention are 2 pathways that we will be focusing on for the next 3-year cycle with the Community Services Block Grant. For the past 3 years, we've been focusing on training in the county offices, and now we're moving toward direct paths. We are incorporating the Empower framework into our counties, and you can see that we've got a roadmap for older individuals, and then we have a roadmap for families and younger individuals. Does anyone have any questions, thoughts, observations about the top 5 or the portion of the needs assessment?
Let me take just a second, if I can, talk about those pathways. You know, we had that unique opportunity, maybe a once in all of our lifetime, to have a large pilot grant like what we have with Empower. We don't see very many $25 million pilot grants come through very often, and so that was a very unique opportunity. We were meeting earlier today, you know, one of the, you know, there are so many lessons that we learned going through that process. And, you know, one of the natural inclinations is to think that money makes a difference in people's lives. And Cindy, you're shaking your head no. That is the one thing we learned, and I was talking to our county navigators earlier. When talking to our families, it was the information, the advice, the knowledge that we gave them through one-on-one interaction that they said repeatedly was the difference maker. It's what made them be able to make that move into a higher paying job or into a more stable situation. You know, I don't want to go through all the ins and outs of Empower, but, you know, one of the things we learned in Empower is it wasn't just an educational thing. You know, we worked with 900-some families. We had people in that group that had master's degrees. We had multiple that had bachelor's degrees. They had formal education, but they had had things happen in their life that had knocked them off track and had them where they felt like they were stuck. And then you add in the benefits cliff and those type of things, they did get stuck, and they were having a hard time getting going again. It was that confidence that they gained through the one-on-one interactions that moved them on up the ladder. You know, those families we helped, one of the numbers we're very proud of, you know, $25 million, you thinking, well, that was a lot of money going to these families. The average benefit that they received financially was only about $2,500. It was more services, it was more knowledge and those type of things that got them where they needed to be. So we want to take that template and put that into everything we're doing. So one of the things we're doing is trying to blend all of our programs together, working holistically. So our recovery programs, our aging programs, our public assistance programs, and look at each client that walks through that door holistically. And I know some of them back there, they've already heard me go through my spiel, so they're just glad to hear it again. And the majority of people we deal with are seniors and those on fixed incomes. And what does that look like? It is financial security. For those individuals, we want to take the lessons we've learned and help them understand how to be more financially secure as they enter into the latter stages of their life. Most of them, like I said, are on fixed income. We have to protect that income. Now, I'm in that boat with probably more in this room. As you wind down your career, you start thinking about going to the house, you always wonder, will I have enough money? Can I live on retirement? Can I live on Social Security, those type of things? It doesn't take very many things happening to throw somebody off track. So we want to work with the individuals we're dealing with, not just enrolling them into LIHEAP or one of the other programs we administer, but offer them some financial counseling as well, not get into retirement systems and stuff like that, but basic accounting stuff. Are you spending more than you're bringing in? What does that look like? Are there things that's happening that can be addressed? One of the things, and Holly Williams is sitting right there, that we deal with more than anything in the state right now is our seniors being taken advantage of. And there's scams and various stuff that people are targeting them, that's costing them money that is unnecessary. And how do we help take care of that? We had an illustration earlier that I used in some training we had last week. We had a client that we were working with, and she had moved here from Florida, and she was still paying gym memberships for some Florida gyms that she hadn't been to in years. Worked out, when we were able to cancel all that, it ended up being about $1,200 a year that we were able to save that client. Just because they hadn't thought through, I no longer living in Florida, I need to cancel that, and some other things. It wasn't just the gym membership. $1,200 in the life of our senior is a huge impact. So how do we work on that? The other thing it hopes to identify if we started, and obviously the client has to be willing to do that, but if they're working with us and they're willing to share their information, you know, we have a lot of seniors that are trying not only to take care of themselves, but they've got a grandson or a granddaughter or maybe a daughter or a son, or they're having to take care of them as well. And we need to help them understand they've got to take care of themselves first. They come first, and once they take care of their needs, then they can help others. But I'd say we've got far too many seniors that are spending more money on family members that are not in their house than they are on their own needs. So financial training, then making sure all the benefits are available for those clients, that they're tapping into everything that they need as they're at the end of their life. And then also physical health. You know, we preach all the time in our aging programs to stay mobile, to stay independent, to have the ability to stay in their own homes. That means physical health and mental health has to be protected. So we've got programs we want to try and work to offer solutions on that as well. So all those things are setting up, hopefully, that the senior population we're dealing with, at the end of the day, we're going to enroll them in whatever program they come to us. But I'm hoping that we help give them more benefits and more services holistically that's going to help keep them in their home, keep them more sustained so that they don't have to go into some type of long-term care facility towards the end. And then the power model that we've been working with young families, we're going to continue that on at a smaller scale, but still keep it going as well, trying to get them to move up the economic ladder. So that's what, when we talk about implementing the Empower framework, that's what we're talking about doing.
Sorry, I have a question on your roadmap, the first one, with the financial planning and the legal, is that even going to get deals and help them with state plans and that type of, those services that are super expensive?
We have Holly Williams. We are dealing now with, of course, Maria Ferrand, which is on this board, passed away. Now we're contracted with legal aid to provide those type of services.
They are, exactly. And Christine McMiniman is now a member of the UCHRA Policy Council. Obviously, she wasn't able to make it today, but she is the managing attorney for Legal Aid Society based here in Cookville, which serves the Cumberland area in Middle Tennessee. Yes, they are now the entity that we contract with to provide free legal services to older adults age 60 and above, with the priority being those who are low income.
Okay, does that also come with like case management? Because like them gathering all their information can be kind of difficult for them. So is that part of it, or you guys give them a list of what all they need to bring you? How does it work?
So yeah, they would let them know what types of items they would need to assist them in whatever way it is. And I will say that also, we're a small contract for Legal Aid Society. They have other funding that comes in from many other different sources. So they're very diverse in the ways that they can represent individuals. And again, their priorities those who are low income, not just population 60 and above. So yeah.
And to add on to that, Keisha, yes, we want to, as we keep training this year and putting more tools in the toolboxes of our county navigators and our county staff, we do want them to start looking at, budgets. We do want them to kind of look at different types of planning. Is it going to happen right off the bat? No. But we're looking for different tools that we can utilize, maybe that if we can input some information in that, then it can kind of spit out different scenarios, different ways that might help them navigate. So that's what we really want to do, is just help folks navigate their life and stop off at places that can be beneficial to them. So our whole goal is to be able to do a lot of those things, but also to know very well and have relationships with partner organizations that's their main focus, so that we can make sure that our folks are being served.
And one of the things, after I looked at the list right there, I'm glad you pointed it out, and I need to refresh my mind a little bit. The other dynamic we're dealing with, and this is not an Upper Cumberland problem, it is a nationwide problem, is we are seeing a move for far more individuals becoming caregivers. I dare say if I asked you to, some in this room would raise their hand and say, I'm a caregiver for my parents or somebody else in my life. A lot of people we're dealing with, they may not be caregivers, but they may be the one being cared for somewhere down the road. There are a lot of resources, and we've got more resources today than we've ever had for family members who are caregivers, especially when dealing with dementia and some issues like that. We need to make sure that knowledge is out there. And as somebody moves towards the end of their life, if they become under the care of one of their family members, we need to know that and be able to support them as well. So that's an avenue where we're trying to look at things holistic, because at the end of the day, in my perfect world, a client comes to us saying, I need energy assistance, I need to sign up for the light heat, and they walk out there knowing that they've got some resources because they're caring for a parent, a guardian, and they know they've got everything that they need is taken care of, and they've got some more information in the back of their mind. If they leave there smarter and a few more resources, we've done our job.
And we run into it in the housing market, a lot of families or individuals that we see. That's why I brought up the case management as part of it. A lot of them don't know what all they need to fill out this paperwork, or where they can go if they've lost something. So that's how I brought up the case management to go along with what you guys are doing.
And we do want, to work with clients ongoing, and that's things that, as of today, we can help run down those documents, right? So any of our offices, if they're needing access to that social security card, or, those are things that we can look for resources, we can help direct them where they need to go. So we can already start navigating, we just want to keep building more and more, into our system so that we are truly, it's just not a one and done, right? That we help navigate, and then when something changes in their life, they're like, we want to reach out to UCHRA because they can help navigate us the way we need to go in this new season.
You notice when Mark's talking, and every time he says the word senior, he looks at me. I don't understand. But there's so many things out there. An example, Holly, I know you deal with this stuff all the time. Once technologies, I don't know, it's good, it's bad, you'd be sitting at home and you'd be talking, and next thing you know, Alexa comes on and answers your question, and you haven't even been talking to her. Or she's trying to sell you something, or you get a text on your phone that, hey, here, my wife and I were talking about buying a washer and dryer, next thing you know, on her phone, the text comes up, here's washer and dryer for sale. It's kind of scary. Just on the way down here, to me, one of the big things that we've got, and I don't know how our legislators can all deal with this, but on the way down here, my wife gets a phone call, and she's got a good friend that's had a call and want her to donate, and I'm not even into the conversation, but I hear her say, don't send them any money. Don't give anyone any money, because over the phone that's called you. How do we get rid of it? How do we eliminate that? Because these people are out there, and boy, they can make you believers, And we've got such a good country here, especially in the upper government. People are out here so willing to give. If they call you, they make you, hey, do you not want to support the police department? Yeah. The fire department? Yeah. Needy kids, do you not want? Yeah, we do. Next thing you know, they've got you, how much do you need, How can we ever eliminate that or get away from that? That's a tough one there, because somewhere up high up, it's got to change.
I think you answered your own question though, because when we first started working on the Empower grant, which seems like quite a while ago now, we talked about with kids, the one thing that changes a child's life is a caring, consistent adult. Well, obviously, after what Mark has now seen, and y'all have gone through the entire program, what changed their lives was having a caring, consistent adult in their life. And what changed your wife's friend is she had a caring, consistent adult that she trusted enough to call and say, do you think that is correct? And so something as simple as that for all of us makes a huge difference, and it's basically free. Just finding that friend that you trust and you can call and say, do you think this is legit? Because it always sounds too good to be true.
Cindy, I'm squirrel just a little bit. You got me squirreling just. That's all right. Yeah, Cindy, you taught the Bridges Out of Poverty for so many years. I've jotted down many times, there's 4 reasons why somebody leaves poverty. And number 3 on your list that you go through is they had a mentor, somebody mentored them along the way. I've got those 4 things written, hanging in my office right there, just to remember. You cannot replace a human face sitting across from somebody else, helping them at the end of the day. Technology is great. We're trying to implement all the technology we can, AI and the various capabilities. At the end of the day, it can never replace somebody, a warm body, saying, I can help you do that. Sorry, I'll be quiet.
Mr. Chairman, that's all we had with the needs assessment.
Okay, now we're back to you again. Linnell, this is her meeting.
This is my meeting.
Yeah, Mark and I are just here to throw in a little bit, and kind of kill a little time.
Squirrel, right?
Right. All right, round table.
Yes, so for our round table, we kind of wanted to continue about focusing on connecting the dots, right? Because it's what we're trying to do. And so I would like to introduce Jacqueline Medley. She is a mobility manager for our transportation department, and she's going to talk to you about all the different types of transportation we have through our public transportation here in the Upper Cumberland. And some of these may amaze you. You may not know some of the different options folks have for public transportation. Do you need clicker, or does Amy click for you? All right, perfect. All right, Jacqueline.
So, yeah, my name is Jacqueline Medley. I'm with UCHRA Public Transportation, and I believe this is the first time I've ever presented in front of a lot of my coworkers. So if I say anything wrong, just kind of bobble along and we'll fix it at the end. But I am a mobility manager. A lot of my position, I do a lot of outreach, coordination, and education with public transportation in our region. So I just want to kind of go over a lot of our services, and maybe you'll take something away from this, or maybe you've already heard it before. So with public transportation, our main mission is to provide reliable, affordable transportation for any resident in the Upper Cumberland area. So I put our mission statement up there. But who do we serve? Of course, we do cover all 14 counties of the Upper Cumberland, and that is over about 5,000 miles around. So we're covering a lot of ground every year. And when I first started, I actually started in the transportation call center, and I'll never forget the first time they asked me, they were like, well, what does transportation do? And I just answered it honestly, and I just said, I think you just get seniors to medical appointments. And little did I know that we actually do a lot more than that. And more that I go out and talk to the public, that is a lot of what people assume that we do. It's just senior centers and get people to the middle. So I just want to take anything away from today is that anyone can ride. That is the biggest takeaway from anything today I say is anybody can use our public transportation services. So over the course of the last few years, we have spent time color coordinating all of our vans. And this has been the biggest savior for someone in my position. As I said, I started in the call center in transportation, so I was booking a lot of the trips. And in Cookeville, we have a variety of services, and we would have people waiting on the sidewalk, waiting for the go routes. And they would call the call center, and they would answer it, I would answer it, and they would be irritated because a van just passed them up. And I would be frantically trying to hunt down the van number, why did they pass them up, and let alone, it was never their van to begin with. It was not a city route, it was actually a door-to-door service. And when I first started, all those buses kind of look similar. So I'll start with the white bus. I'm sure you've all seen it. This is the bread and butter of UCHRA public transportation. This is our door-to-door service. And of course, we do have satellite offices in all 14 counties of the Upper Cumberland, and this service is out of every county office. So whatever county a resident lives in, if they need to use our door-to-door service, they will just call the county that they live in. And of course, we've got our wonderful county coordinators here. They all know about this. So with this, we ask at least a 3-day advance notice. So if you know you live in Ventress County, you need to get to somewhere in Ventress, at least a 3-day notice is always great because our schedule does get busy. I'll kind of lean more into like what our metrics are towards the end, and it blows my mind every time I look at the numbers. And with the door-to-door service, fare is $2 each way in county. So when someone schedules a door-to-door service and they're staying within their county, each way it's $2. They get on the van, they'll have their $2 exact cash, they'll hand it to their driver, they'll sit down with their seatbelt on, and then we'll get them to where they need to go. And of course, we offer discounted rates, half price for veterans, seniors, 60 plus, and people with disabilities. And whenever you're calling ahead of time, talking to the county office, there's ways that we notate the account, and then the half price will already be added. So if you have a senior that's getting around town, it'll be $1 each way. And then next, this is our beautiful green bus. So whenever you see a green bus around town, just know that they are going outside the Upper Cumberland region. These buses go to Nashville and Murfreesboro. And from Cookeville alone, we go to Nashville 3 times a day, Monday through Friday. And a lot of people use this service, believe it or not, to actually get back and forth to the airport. In the morning time, if you're at our hub in South Jefferson, in the morning when they're waiting for the Connect to go, they'll have suitcases ready to go, and it's really great if you don't want to pay the fares to park your car at the airport. Of course, we take a lot of people down to the medical plazas as well. We take a lot of people down to Vanderbilt Centennial. I've even scheduled trips people get to the zoo and back. So this is a really great service. If you have people you know that need to get to Nashville, need to get to Murfreesboro, know they have an option with us. And Murfreesboro, we take a lot of people to the VA clinic. And from Cookeville to Nashville, it's $10 each way. Again, 3-day notice is always great, and you pay exact change when you get on the van, and it will get you down to Nashville or Murfreesboro. All right, so the city routes. I'm sure you've seen our big, beautiful maroon buses around town. So this is no different than when you go to Nashville, you see the big purple buses going around. We have deviated fixed routes, and they're offered in 4 cities. We cover Cookeville, Allgood, McMinnville, and Crossville. And these are on hourly loops around the city. And the service is actually fare free. And we have seen an explosion in ridership in the last 3 years. And really, it's because we went fare free, and a lot of outreach and education of showing people, when I drive down Interstate Drive in Cookeville, and I see that bus shelter in front of Logan's, that is for this service. People wait for the bus. We try to stay on schedule. We formulated the routes so they hit the high points of the city. We try to hit the medical plazas, grocery stores, anything like that. If you live off the route and you don't live right on there, but you're just right there, we can deviate up to 3/4 of a mile. And I know that's a little hairy, so again, when I started the call center, I was always trying so hard to figure out it's at 3/4 of a mile. But you do have an option if you don't live right on the route. And it'll go along with that Go Route service, the fixed route service. We have a handy dandy app that will actually, people can download or they can get on our website and actually track the bus. So if you are at Walmart in Cookeville and you didn't want to wait outside, you can actually download the app and know that the blue route's going to hit Cookeville. And you can actually see the pin moving, so you'll know to be out, ready to go, and home on the van. So it's really great if you do utilize the Go routes. You can actually pull it up and you can follow the buses all day long. And then our newest service, the bright blue buses and Mustang Monkey. That's right, we're stepping into the 21st century. So if you see these buses around Cumberland County and Putnam County, know that this is similar to Uber and Lyft. It's app-based service. People can download the app, it's pick up over Cumberland, and it's just like Uber and Lyft. Just give our flex that we're stepping up in the technology world, but you create an account, you have your payment method, you pick your destination, and you can actually see the estimated time of when the driver's going to come by and pick you up. And this is a really great service because we even just did a test last week where I just downloaded the Uber app, and I put from our office in Cookeville just going to Tennessee Tech, and that's not even 2 miles. And with Uber, that was $16 one way. And of course, with Uber, you don't know who's going to pull up, and you don't know what vehicle it is. So if you utilize the Pickup Over Cumberland service, just know it is one of our public transportation drivers and a public transportation vehicle. And you might get lucky to get Billy Gilbert, who drives around the electric Mach-E that's painted the same color. So that's a really great service for Putnam and Cumberland.
If you utilize that service, are you on that van by yourself, or are there others in that?
It just depends. So there is a possibility you can get on the van, there's someone else. But most of the time, it's pretty one-on-one, more of a curated rider. And plus, the fare is a little bit more expensive versus the door-to-door service. But more than likely, it's more one-on-one or maybe another passenger.
Thank you.
Well, you talk about an airport, which is very beneficial. If you're running this area, I'm a user of that. If I have to drop my car off at the repair shop, I don't have to bum or ride or get somebody to come pick me up. I just take the shuttle or take that couple of Cumberland vans back and forth and get my car.
Yeah. And that Mustang Mach-E, the electric vehicle, I was not a believer in electric vehicles, but we took it around town, Amy and I did last year to get some photos of it, and I drove it, and I cannot believe how smooth it was, and it's just a really great service. And with the airport, the other thing is getting people back and forth to the airport with our Green Connect service is we don't run on weekends, so that is the only caveat, but if you did have a flight, or if you need to get to Nashville weekday, we can definitely get you there.
Jennifer, I have a couple of questions.
Yes.
What about kids? Do they have to bring their own car seats and things like that?
Yeah, typically we ask, whenever they're scheduling throughout our service, say it's the door-to-door service, and you do have a child, we definitely need the full count, so we can account for that on the van. And typically, we do ask if you can bring your own car seat, then we can secure it.
Okay, and then what hours during the week do, like the pickup Upper Cumberland, what hours does that run?
So it just depends on the day, and I might be a little wrong, but I know it runs later than our typical door-to-door service. I do believe Monday through Thursday, it runs 6 to 9, and then Friday and Saturday, I think it runs till 1 a.m. I'll have to double check on the website, but plug for our website though, is a really great service. We have formulated all the services, all the color-coordinated vans, each have their own distinct page on the website. So if you ever did have questions specifically about the times we run it or anything like that, you can just pick a page and it will give you all the description of the services. I know, Amy, that's been a labor of love. So a little plug for our website.
So if Cindy stays out too late on Saturday night, and drinks a little too much, you can do that.
That's what she's checking.
Get you home.
And you know what blows my mind about the pickup of Cumberland service, the app-based service, is we first thought it was just gonna be for Tennessee Tech students. We thought a lot of people would be out of town and they would maybe just wanna use us to get back and forth to their apartment. But really, the ridership comes from people going back and forth to work every day for that pickup service. So that's pretty, marketing wise, it kind of blew my mind, because I thought it was mostly gonna be college students, but it's actually people who are just going to work. And that's a really great transition, because we're on the job access slide. So a lot of people, like I said, they use public transportation in general to get back and forth to work. And we do have a job access program, and it's Collier County office. If people are using transportation to get back and forth to work, it is income eligible, and they'll have to fill out an application, but if they are approved, it can pay for their transportation to employment and back for up to 12 months. And that does include if they need to be dropped off to childcare.
We're very proud of that. We're up
Yes.
to about a third of our trips for transporting people to and from work.
Absolutely, it
Great.
blows my mind. So then also, our senior tickets. And we have a really great partnership with AAAD, and every year they purchase an allotment of tickets, and they're distributed to their senior centers. We have 19 in the region. And this is a really great, if you have seniors who can't afford the fare, if you needed to get around town, or if you needed to get to Nashville and back, and you couldn't pay the $10+ to get back and forth, they can visit their local senior center and get vouchers for this. Make sure it's a ticket each way, so make sure you at least get 2, but that is always an option for seniors if they are utilizing public transit to get back and forth. And a little cameo of me, and that's our coworker. I thought I was travel training him, so that's not a real photo. But travel training is a lot of what I do in transportation. A lot of it is just trying to show people that public transportation is not scary. I know when I first started, I could not imagine you telling me to get on a van and you're going to get me back home, especially if I'm going to Nashville, Murfreesboro, or getting me across county lines. So this is a lot where my job comes in. I can either walk with the client or just get on the phone and explain to them the situation of, you get on, you have your exact change, you pay your driver, sit down, put your seatbelt on, or like our go routes. If you call and you don't know where, you just moved to the area, you want to hop on the fare-free go routes, the maroon buses, you don't know where to go, where to stand, where they even, anything. That's a lot of where my training comes from, is just building that confidence in using our public transportation services. This is a fun fact. This is what blows my mind every day, but, so we just closed out our fiscal year, and on average, fiscal year 25, on average, we were doing 1,200 trips a day. Last year, we were doing 1,400 average trips a day. So it's pretty crazy ridership, and then we did over 349,000 trips last year. And on average, every day, we have 101 vans. So that's a lot. We're going a lot north, and God bless our maintenance shop, because they keep the wheels going. And then, of course, we do have a 93% on-time arrival rate. And everybody has heard this, but my fun fact is, we closed out and we did over 3.6 million miles last year alone. So we're covering a lot of road. And Mr. Farley got a new number, so going back and forth to the moon 3.6 million times is 7.5 times. So that's how much we drove last year collectively, is we could get back and forth to the moon 7.5 times. So. And this is where I'm going to need my cheat sheet. So, don't you love the pun, but the road ahead for UCHRA. And so, of course, investing in our drivers. Our drivers are the heart of what we do. If we did not have them, we would not be able to do anything. And even just going on the road, even for myself, I underestimate how much, not even just physical, but mental, you know, you get on the van, we have a lot of riders that they built such meaningful connections with our drivers. And even just, I was riding around with a lady last month, I'll just tell you this really quick. She was really travel training. She was scared to never rode any of our transportation services. And she did not even know where to start. And so we had phone calls, and I rode with her to her equipment and back. And just even the driver, I didn't even feel like I needed to be there. The driver, she did such a great job of making the rider feel so comfortable. And it turns out they were from the same city, and they knew the same people. It was just so wonderful knowing that our drivers have the heart in it. And of course, I have some notes I need to throw out there too, if you can tell. But so for the future, what we're looking for is an excellent onboarding. So we're going to focus on a 90-day mentorship. We're going to take some of the core top performing drivers and do more of a 90-day mentorship with our new incoming drivers. And of course, we're going to try to focus on data-driven recognition. We're going to track milestones in the million-mile club and safety. So we're going to try to pull data to show what drivers are doing the most miles and who's staying safe on the road, because you never know what's going to happen. And then next, we're going to elevate the rider experience. So in the future, we're really looking forward to placing some QR codes in the van, see if there's anything that needs to be fixed or cleaned, so riders can take pictures or scan the QR code and fill out a short survey. And then also innovation. We're really focusing on, since we're hauling so many people a day, we really want to focus on the comfort. So we really do want to kind of get our fleet up to standard and maybe expanding more of that pickup Upper Cumberland on-demand app into other counties. And again, if anything you can take away from today is just anyone can ride. I know when I first started, I was overwhelmed by all the options. And of course, I wanted to throw out there the chip clips that we've handed out has our 833 call center number on it. They're open Monday through Friday, 6 to 6. Great resource. If you have any questions, any inquiries, don't know where to start, you can always call that, and then you can always get to me as well. So does anyone have any questions for me? Hopefully I did one
All right, thank you, very good. You have any old business to bring up?
I don't know if this is the perfect place to bring it up, but I just wanted to let everyone know that the emails from the policy council will be coming from me for the foreseeable future. One thing that I'm probably not going to be able to do that like Sherry Turner did is to call you guys to follow up, see if you're coming. So does everyone get the emails that we send out with the information? If you do, if you could just, I'm going to always ask you, please respond back to this email if you're coming. If you can do that, I'd appreciate it. If someone does not have access to email and can't do it that way, get with me and, and we'll reach out and give you a call to remind you or something like that. We are going to try to start moving away from those phone calls and just interacting through email.
All right. Any new business? Public comments? Mark, anything else? Nope, I didn't do it. I appreciate everybody coming to join us. Go vote. Go vote early and often. Looking forward to TV getting back to normal. All right. Motion to adjourn?
Motion to adjourn.
Motion, got it. Second?